Another potentially deadly virus is lurking. The CDC says early October is when flu activity starts to pick up. So how can you tell if you're sick with the flu or COVID-19? Take a look at the symptoms that are similar between flu and cold. They're basically identical. Fever, cough, sneeze, difficulty breathing, sore throat, runny nose, headache, vomiting, and diarrhea. Even loss of taste or smell can happen in both flu and COVID. But doctors say it happens more frequently with COVID. So what can you do? Dr. James Jarvis from Northern Light Health explains how to keep yourself and your family and friends safe as we head into the peak of the season.
Clinically, it is often difficult for us to distinguish between the two because they share a lot of similar features.
If you're feeling those symptoms, especially fever, doctors say you should get a COVID-19 test just in case and call your doctor.
Because we do really need to know the difference about whether this is influenza or COVID-19. The treatments for the two are different, and therefore you need to have that in mind. And of course, it makes a difference for the other people in the household. COVID-19 is far more infectious than influenza is, and so we want to make sure that if somebody's positive for COVID, we're protecting everybody and not just the individual who has the positive test.
Dr. Jarvis says testing is critical because COVID-19 affects far more organ systems after the person gets sick with that virus. Those tests also help hospital staff decide where to quarantine a person to prevent spread to other patients and staff. He also pleads with people to get a flu shot to avoid going to the hospital in the first place.
That just adds to the burden that our hospital systems are having right now in managing not just COVID-19 patients, but managing all of the other things that need to be in an acute care facility. That's just one more hit to the resources that are so precious right now.
Another concern? Last year, a state of emergency led to widespread mask wearing and social distancing. Flu cases were few and far between. Now, those requirements are gone, replaced by suggestions that doctors hope people will follow.
All the precautions we were doing to protect ourselves against COVID-19 worked to prevent spread of influenza as well. So that is our fear, and that typically happens with influenza. We'll have a mild flu season, and then everybody lets their guard down, and the following year we have a bad one.
Dr. Jarvis says yes, it is safe to get your flu shot on the same day as your COVID-19 vaccine or COVID booster shot. You can catch the full interview with him on our website and app.